Hey guys, it's Brittany. Today we're going to do another study on using antibiotics and homeopathy in conjunction. This time, instead of in vitro like I did last week, it's actually in real people, and it's in tuberculosis, which of course is a very important, very severe infection, and it's a massive problem when tuberculosis has drug resistance, because it is such a infectious and serious disease, right? So this study is looking at whether or not adding homeopathy to the standard antibiotic care improves outcomes. And they have some interesting findings. So the full title is Homeopathic Treatment in Addition to Standard Care, right? In addition to standard care in multi-drug resistant tuberculosis. So this is randomized, double-blind, placebo-controlled clinical trial. It's coming out of India. The authors are here, Chand et al., basically. Okay, and this was published in the journal Homeopathy in 2014. So you can find it there. Okay, so the way they did this trial is that they took people who had multi-drug resistant tuberculosis. And so what that means is that when the person was diagnosed, they cultured the sputum in a petri dish and saw whether or not it was resistant to two specific antibiotics. And those antibiotics are rifampicin and isoniazid. Hope I didn't totally murder those names. So the standard of care for patients who fall into that category, at least at this time period and in India, and according to this paper, is a group of antibiotics. It's like 6 different antibiotics that they list down in the paper, and it's for 2 years or more. And according to this paper, even with 2 years of all of these antibiotics, there is still only a 48% success rate. So this is a massive problem, right? So what they did was they took 120 of these people, and in addition to the standard of care, they also got homeopathic treatment. So the way they did that was they had 2 homeopathic doctors, and in India, of course, they are actually homeopathic doctors. And they also they called it a senior consultant. They didn't explain exactly what a senior consultant was, or what the senior consultant did that was different than the homeopaths. I'm assuming what they had to do is that they all had to agree on the remedy choice between the 3 of them. And of course, that's trying to get at the fact that there's variation between homeopaths, and if you only had one homeopath, essentially what you would be testing is how good that homeopath was, right? Because if you got horrible results, you could argue, oh, well, maybe it was a horrible homeopath. So by having multiple homeopaths, they're trying to get around that problem. And so they decided on the remedy choice together, and then the patient would take their prescription to a pharmacy, get the remedy or placebo. They wouldn't know which one. So the homeopathic doctors didn't know if the person was going to end up getting placebo or homeopathic treatment, and the patient didn't know if they were picking up their placebo or homeopathic treatment, and therefore double blind. Weirdly enough, though, they had a group of only 12 remedies that they could prescribe from. So the 3 of them would get together and choose the remedy. And then if that remedy was not in that 12, they would essentially choose like the next best remedy that was in that group of 12. They don't explain why they do this, but my guess is that they had to create a placebo for every single remedy prescribed. So if the person was prescribed arsenicum, for example, at the pharmacy they had to have placebo arsenicum, and they had to have verum treatment, true arsenicum 30C or 200C. So they had to have placebo 30C, placebo 200C. They had to have true 30C and 200C arsenicum, because otherwise it's not double blind, right? And it's not like you could have like a big bucket of placebo pills and just scoop them out and give them to the placebo people, because obviously that's a massive, massive, massive clue that they're getting placebo, right? And you can't even do it in a back room, because then the pharmacist knows, oh, this person is getting placebo, right? So it's a massive problem when it comes to blinding, that you have placebo that it truly looks like placebo, that you really, really, really can't tell if it's verum treatment or placebo. So I'm guessing that's why they had these 12, because you can't have, the amount of money and time it would take to set that process up for 1,000 potential remedies is just, it's mind-boggling, right? One second, I need a tea break because I'm getting excited and my throat hurts. As you can hear, I'm fighting a cold. So, I'm again, that's why I'm guessing they had these group of 12, but it's also a huge limitation in the study design, because if somebody needs Drosera, like I do today, and it's top of mind because I was just reading Bunninghausen's characteristics of Drosera, and he talks about in particular types of tuberculosis that need Drosera. So, right, I'm not talking about something that's totally out of the question. It's not part of the 12. The 12 remedies that they chose were all polycrests, so lycopodium, calcarb, arsenicum, pulsatilla, the big hitters. So, of course, because they're a polycrest, they're going to often be indicated, and they're going to have an effect in many, many cases. But this, you're severely limiting our potential ability to help somebody homeopathically if you were cutting it down to 12 remedies. People make a big deal of the Bunninghausen method because there's only 125 remedies. They're like, oh, how could you do anything with 125? And now they've limited it down to 12, right? And one of those is the nosode, tuberculinum, of course. So it's 11 polycrest remedies and a nosode. So, again, a severe limiting factor in my mind. And then they also only dosed once or twice a week. This is not out of the question in homeopathic circles. Certainly there are people who dose a lot less frequently than that. I have seen cases of people dosing once a year, which just gives me anxiety, I must say. I have a hard enough time convincing people that one drop once a day of something is effective, let alone giving them 3 pills once a year. Oh my God, I can't even. But so they're only talking about once or twice a week. And I wonder, we're going to see in a second, they didn't have amazing results in this trial, although there's still a lot to talk about. But I wonder if potentially part of the problem they didn't see amazing results is they weren't following up super frequently. They weren't giving super frequent doses. There's a lot of room for improved homeopathic care, I think, in how they did this study. So anyway, I went off on a lot of bits of tangent on how they did it. But so they, like I said, it was 120 people who were diagnosed with multi-drug resistant tuberculosis. And so 60 people got the homeopathic treatment and 60 people got placebo. And they say the medicines have been used in infrequent doses. And that's what I mean by the once to twice a week. They say later in the paper it's once to twice a week. That's what they mean by infrequent doses. They don't say what makes the difference between prescribing someone something once a week or twice a week. They do also, though, have them taking placebo pellets 3 times a day, even in the treatment group. So you can see, they're really trying to work on people's placebo response, right? Because you're saying, oh, you have to take this medicine 3 times a day, but only once to twice a week are they actually taking something, and that's only if they're in the treatment group, but they're taking placebo 3 times a day for the rest of the week. Not necessarily a method I love, but whatever. They don't have to please me. So the main outcome measure for them, the primary outcome measure, was sputum conversion, meaning whether or not the bacterium, tuberculosis, could be cultured in the sputum. And they considered treatment successful if it used to be able to be cultured in the sputum, and then it was no longer able to be cultured in the sputum by the end of the trial, which lasted a couple years. This was a long time coming. They spent, I think it was 2003 to 2008 were the years of working on this study, because they had to have many years of enrolling people to get enough people, and then they had to do at least 2 years of treatment, right? Because standard regimen is 2 years of antibiotic treatment. All right, so they were looking at sputum conversion as the main outcome measure, but then they also looked at chest x-ray changes, and this population that they were working with all had severe chest x-rays in the sense that they had a lot of evidence of tuberculosis in the chest x-ray. Then they also looked at some blood levels of ESR and hemoglobin, weight gain, and then clinical improvement. So this is subjective symptoms that they asked on a questionnaire. Okay, so the results. So in the abstract, they say there was an improvement in all outcome measures as per intention to treat and per protocol analysis. So intention to treat is when you analyze everybody who went through the study, so the 120 people who went through the study. The per protocol is people who actually did what they were supposed to. So actually took their antibiotics, actually came to all of the follow-ups, and it's common in drug trials to do both intention to treat and per protocol. Now, improvement in all outcome measures is a little bit sneaky. I gotta say, it annoys me a little bit because I'm like, sort of true. So every outcome measure slightly favored homeopathy, but nothing was statistically significant except for chest x-rays. So it's highly misleading to me to just say everything improved with homeopathy. There was slight favoring for the homeopathic treatment, but chest x-ray was the thing that was statistically significant. Okay, and that's here. Statistically significant improvement was seen in chest x-ray in 37 in the homeopathic group and 20 in the placebo patients. Okay, and then they say if you look at only the people who had positive culture, so the bacterium was able to be found in the sputum, then there was further improvement in the chest x-ray. So the p-value is even smaller. You see 0.0005, whereas here 0.002. And weight gain, increase in hemoglobin, and reduction in ESR with add-on of homeopathy. Cure rate was 11% more in the homeopathic group. The reason they're saying 11% more is because it's not statistically significant. If it was statistically significant, they'd have a p-value there. So I want to talk about these p-values for a second, because with every single p-value you calculate, there is a chance you're going to get a false positive, meaning that it looks like something's statistically significant and that your treatment in fact did something, but that it's actually due to random variation. If you do the coin toss 100 times, there is a very, very small chance, but a chance that you will get heads 95 times and tails 5 times, that just due to random variation. And when you do multiple p-values, you increase the chance that you're going to get a false positive. So there's a way of controlling for this, and you'll see why I'm bringing this up in a second. So, and it's called the Bonferroni method, and it's considered to be super, super conservative, but sort of like for that reason, really powerful, of seeing whether or not your results can be taken as truly like your treatment is doing something versus it's potential that you're getting false positives because you've run so many freaking p-values. So, right, if they ran 100 p-values, the chance of them getting a statistically significant result, a p less than 0.05, is high just because of random variation. So in this study, if you consider intention to treat and per protocol analysis, they ran 26 different p-values. I can show you the table. Okay, so it's cut off a little bit here so that you can't quite see the placebo and the p-values here, but this is endpoint comparison of study participants, and they have intention to treat and per protocol here. All right, and they have a p-value for every single outcome measure. And obviously I can't draw today. And they have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13 in intention to treat alone, and then they did another 13 per protocol. So they have run 26 different p-values. Now, according to the Bonferroni method, what you would do is you take 0.05, so that's the p-value you want, it's less than 0.05, and you divide it by the number of times you have run your p-value test. So this would mean that in order for something to be truly statistically significant to the most conservative method, the Bonferroni most conservative is like the most conservative, you would have to have a p-value of less than 0.0019. Why am I bringing this up? Because the chest x-rays actually are about there. So if you look at improvement in the chest x-ray, let me minimize my calculator. So improvement in the chest x-ray in intention to treat is 0.002. Very, very close. And what you can't see, because it's cut off here, is in the per protocol, that's even smaller. So for people who actually took their medicine, the p-value is 0.0005. So it's even matches the Bonferroni super conservative p-value analysis. This is also true, but even more so, for people who got worse. So for people who got worse, more people, 18 on placebo versus 2 in the homeopathic group, the p-value is 0.0001. Very, very, very statistically significant. And that's the same in per protocol, 0.0001. So the reason I bring this up is because they have some very, very interesting results in the chest x-ray. But I think they were so focused on trying to get as many potentially statistically significant results that they kind of gloss over that actually in the abstract. So in the abstract, they mention it, but they say everything got better. And then they report culture positive patients. There was the chest x-ray, still very, very significant. But then they also talk about weight gain, which we now know from Bonferroni would actually not be correct. And, if you included sub-analysis groups, you'd have to adjust Bonferroni because they're reporting even more p-values, right? So it would have to even be smaller and smaller and smaller and smaller. So you can see also the more p-values you run, to a certain extent, you're shooting yourself in the foot because, you're just trying to find something to report in your abstract. And then also, increase in hemoglobin for Bonferroni, that would not be statistically significant, and neither the ESR. I know that got a little bit into the weeds of statistical significance and things. To zoom back out a bit, what this shows to me is that we have an amazing objective measure, chest x-ray, that's improving with homeopathic treatment, that in my mind is not fantastic homeopathic treatment. They're not getting a lot of follow-ups. They're limited to only 12 remedies. I mean, again, to me, that's a huge limitation. And even so, they are still getting amazing results in amazingly significant, statistically significant. I have to be so careful because, of course, just because it's highly statistically significant, that means that our treatment is doing something, but it doesn't mean how much the treatment is working. It doesn't say that their chest x-ray improved to a ginormous degree, right? It's just saying homeopathy did, in fact, change the x-ray, and we can be very sure that the effect was due to homeopathy, not something else. I find this so hard because it is so hard to talk accurately about this stuff. It is so easy to get carried away and make a sentence that it's over extrapolating results. And so then basically what this is saying is that, again, homeopathy works great with antibiotics. We don't have to be obsessed about an either or scenario. Also, it shows how incredibly safe it is. This is a very, very, very serious disease. Drug-resistant tuberculosis. Very, very serious. And the most significant result was that there was less worsening with homeopathy in the chest x-ray, right? So we can, put that little feather in our cap when people talk about the potential danger with homeopathy being neglect, essentially, right? We can say, no, look, like the most significant finding was that people did not get worse. I know that's a weird thing to say, but that is often the critique with homeopathy, right? That people are worried that people are going to get worse because of essentially neglect, right? And this is on antibiotic care, so it's also not like the people who are getting worse on placebo are getting worse despite the fact that they're on this insane antibiotic care, right? This is not like they did nothing. All right, so very, very cool. More evidence for complementary medicine. However, a lot of room for improvement with the homeopathic treatment. And it's curious that none of the other measures were statistically significant. So there's a lot of stuff to probe into there if there was able to be a follow-up study. So I hope you found that interesting. I did. Until next time, bye.